Hi, I'm Steve Rowe, Executive Director. I'm recording on Wednesday, April 20th for a video that will be uploaded and available to you on Thursday, April 21st. I apologize that you're getting me for the second week in a row, and most likely you will get me again next week for the third week in a row. Kim Bergen-Jackson, our administrator, is traveling starting today for work, and then next week she's going to be traveling for vacation, some very well-deserved vacation time that she will be spending with her family, visiting the Grand Canyon among other places. So we miss Kim, but you are stuck with me for today at least. Last week I talked a little bit about the CREATE training that we were going to be doing last Thursday. We did do that training at my house, and it went really, really well. There were 13 employees there, plus Kim and myself leading the training. And I made the offer to all of you that if any of you are ever interested in participating in one of those training sessions, to please let me know. I did hear back from a couple of residents after last week's video, and it's like we will get those two people scheduled into future training sessions, but the invitation is still open. So if any of you are potentially interested in seeing what that training session is like and experiencing it firsthand, you are more than welcome to do that whenever it works. So please just let me know. COVID case counts in Johnson County are on the rise, unfortunately, with the Omicron BA.2 subvariant. Last week I reported that we were averaging 16 new cases per day in Johnson County. This week the number's up to 21 new cases per day. It's certainly not insignificant, but it is also 5% of the case counts that we were experiencing back in mid-January when the case counts were well over 400 new cases per day. So it's still just a very small fraction of what we were dealing with 3 months ago. Kim provided some talking points to me on her way out the door today. She wanted me to tell you that the vaccinations are effective for this strain, but you could still become infected, just like you have had that risk all along, become infected even though we've been vaccinated and boosted. The power of the vaccine and the booster is that if you do become infected, you're more likely to not get as sick, and the risk of hospitalization or death is very greatly reduced because of the vaccine. So most people are not getting very sick from the new variant, and hospitalizations at university are still way down. We hope that continues, but do want to let you know case counts are on the rise. According to the website that I looked at to pull case counts this morning, Johnson County leads the state of Iowa in terms of vaccination rates. So among our resident population, those 65 plus, 95% of the residents of Johnson County are vaccinated. For those 18 and older, we have a 79% vaccination rate, and for the entire population now that kids have been eligible, almost all kids have been eligible for the vaccination, we have 72% of the entire population of Johnson County that has been vaccinated. So generally, things around Iowa City, most of the people that you interact with are also vaccinated, and so the risks should be lower interacting with people around town. We do want to urge you to continue to be cautious if you're out and about in the community. If you're unsure what to do, always make the safer choice. So put a mask on, try to social distance, and try to stay away from large crowds if that's at all possible. We also want to remind you to keep washing your hands and using hand sanitizer, as that really is the best prevention for spreading the virus. As of this recording, we are not aware of any COVID positive residents right now. This past weekend, we did have one employee test positive. That person had worked in the health center through the weekend, tested each day, but had tested negative 2 times and then tested positive the last time that individual worked. So we do have a positive case. We did contact tracing for anybody that person may have interacted with, and have been doing testing of staff members and residents that they would have been in contact with. All of those follow-up tests have been negative, but we do have one positive employee at this point. Earlier this week, we held a booster clinic in the Hayden room. For those of you who were there, I want to apologize. I know that the wait was longer than we would have preferred for many of you. Our pharmacy has the supply of the vaccine, and they get paid by sticking the needle into people's arms. So we were not able to help administer the doses this time, and they were probably understaffed for how many people came to get the booster dose. So can't really control it. It was available. I know it was a longer wait than we would have preferred, and I'm sorry for that. We will try to communicate with the pharmacy if we have future occurrences to bring enough staff people to keep things moving. But it is what it is, and we're past it, and many of you got boosted earlier this week. If you missed that particular clinic, we will be holding a second booster clinic next week on Monday, April 25th at our East Campus. That clinic will run from 10 a.m. to 1 p.m. And if you plan to participate in that clinic, please call Laura O'Connor, our wellness director. Laura's phone extension, if you're dialing internally, is 3068. If you're calling her from a cell phone, it is 319-466-3068. And just let Laura know that you are planning to participate in that booster clinic next week, again Monday, April 25th from 10 to 1 at the East Campus. Yesterday, I celebrated my 23-year anniversary of working at Oak Knoll. When I started in 1999, the Benton Street East addition had just been finished. We were still moving some of the initial first households into brand new apartments in 99 after I started. Since that time, we have converted independent living apartments to assisted living apartments back in the year 2000. We replaced the original health center with what exists today in 2004. We opened the George Building, which added 51 apartments in 2006. We opened the Spring Building, which added another 70 apartments in 2015. We converted 3 independent living apartments to our short stay unit space, which is 10 private rooms and the therapy suite. That project happened in 2016. We converted another 6 independent living apartments to a 12-bed short stay or loft unit, our memory care area, and that happened in 2018. In 2018 and 2019, we acquired 13 condos at One University Place and 1 house on Wild Green Road. And then most recently, we opened up the East Campus in 2020. We have the capacity now to serve 193 households that we did not have the capacity to serve back in 1999. Almost all of those 193 additional living units are occupied. We've also grown our At Home with Oak Knoll program, the home care program, and that is something that didn't even exist 5 years ago. This year, our primary focus is trying to figure out the best options for increasing the number of assisted living apartments, increasing the number of health center spaces, and improving the environment of assisted living, either through a very, very significant renovation or a replacement of that part of the building. We've started to work with an architect, and they are helping us explore various options. So we gave ourselves all of 2022 to try to figure out what is next for assisted living, but by the end of this year, we hope to be able to show you what we think is the best path forward. And I am really, really looking forward to being able to share with you what the future plans are and what we would like to do. So that is our focus for right now. I hope you're all doing well. I am tired of cold weather and I'm tired of gray weather, but hopefully sometime soon we will see temperatures in the 70s and sunny skies. Maybe next week. We'll talk with you again next week. Take care.